Type 2 diabetes in children and adolescents. We're going to go over epidemiology, risk factors, and prevention strategies.
First, looking at the background, type 2 diabetes is characterized by insulin resistance and beta cell dysfunction. And while it was historically considered an adult onset disease, we are now seeing a rapid rise in pediatric cases. What's especially important in youth is how early metabolic dysfunction begins. Many children experience impaired glucose regulation years before their diagnosis, then suggesting that this disease develops along a continuum rather than appearing suddenly. Therefore, the goal of this presentation is to examine the epidemiology, risk factors, and prevention strategies of pediatric type 2 diabetes. The significance of this problem is that it is an important public health issue because type 2 diabetes in youth tends to progress faster than it does in adults. Young individuals are more likely to develop complications earlier in life, such as kidney disease, compared to those adults with type 2 diabetes and even youth who have been diagnosed with type 1 diabetes. Because of this, they face a much greater lifetime burden of disease and even a higher risk of premature mortality. When looking at who's most affected, there are clear health disparities. Type 2 diabetes is more common among Hispanic, Black, and Native American youth. These disparities are strongly tied to social determinants of health, such as socioeconomic status and access to healthcare. Youth living in urban or underserved communities are especially at risk, then highlighting the need for more equal access to health interventions and prevention care.
Methodology. For this presentation, we did a structured literature review, which was conducted using peer-reviewed articles, reports, and newspaper articles within the last 5 years. We used databases such as PubMed and Google Scholar. We reviewed 30 articles, all focusing on pediatric populations. We used keywords such as pediatric type 2 diabetes, obesity, and AI.
When looking at epidemiology, type 2 diabetes in youth is increasing pretty quickly, both in the US and globally. So, if we look at the graph on this slide, the CDC projects that cases could reach around 220,000 cases by 2060. But what's really interesting is that there's other research that was done by NHANES, and that estimates that it would be even higher number, closer to approximately 526,000 cases by the year 2060, especially when factoring in the higher risk populations and minority populations that may be being diagnosed with type 2 diabetes for adolescents. So, depending on the model and the assumptions being used, we're looking at a pretty wide range, but both projections still show a major increase. It highlights the same points, which is that it's just not a small rise over time, it's a rapidly growing public health issue. We're also already seeing that type 2 diabetes makes up about half of diabetes cases in adolescents, and a large portion is still undiagnosed. So, overall, this slide really emphasizes that the burden is not only increasing, but uh, there's a need for early prevention and intervention is going to be very important for this population. The development of type 2 diabetes in youth is influenced by multiple overlapping risk factors. These risks often cluster together. For example, children in lower socioeconomic environments may experience poor nutrition, reduced opportunities for physical activity, and limited access to healthcare all at once. This clustering increases cumulative risk and makes prevention and intervention more complex. Other risk factors being poor diet and lack of physical activity, individuals already being overweight and or obese, genetic predisposition. There can also be environmental influences, just like I spoke about with the socioeconomic environments. And then also there is a multifactorial disease etiology that needs to be looked at as well. One of the most significant risk factors is obesity, with about 75% of affected youth classified as obese. The underlying mechanism is largely driven by inflammation. Adipose tissue acts almost like an endocrine organ, releasing inflammatory cytokines that interfere with insulin signaling. Over time, this leads to insulin resistance, forcing the pancreas to compensate until it can no longer keep up, then ultimately resulting in diabetes diagnosis. While 75% of those with pediatric type 2 diabetes are obese, obesity does not explain every case. About 25% of youth with type 2 diabetes are not obese. This highlights the role of genetic and metabolic factors and suggests that relying solely on BMI may not be sufficient for screening. It supports the need for more individualized approaches, possibly including biomarker based screenings to identify at risk individuals earlier to then provide the individual with appropriate treatment and care options. Looking at both the financial and emotional burden of type 2 diabetes in youth goes a lot more complex than just medical costs alone. So, looking at the graph, you can see that a large portion of these patients rely on public insurance, and many come from lower income households, with about 40% of them making under $25,000 a year. So, right away, this shows that the disease is heavily concentrated in more vulnerable or minority population. The graph also shows that the youth with type 2 diabetes are about 2.6 times more likely to be hospitalized versus those who do not have diabetes. So they will have twice the medical expenditures as well. This isn't just a one time cost due to having a chronic disease, it's an ongoing long term care that can add up over time. And because of that, and with it starting early, these individuals are dealing with healthcare costs for a much longer period of time. But beyond the financial side of things, there's also a major emotional impact as well. Managing a chronic condition at such a young age can be overwhelming, especially during adolescence, where things like independence, social life, and identity are already developing. Many youth experience stress, anxiety, depression, and even issues with stigma, which can affect how they stick to treatment and manage their condition. Therefore, making sure that there's long term economic aid and also treatment and bettering of the understanding of this chronic disease are so important with prevention as well.
Disease progression. The youth experience more rapid beta cell decline and poor response to treatment compared to adults. Due to this, there's an early need for intensive treatment to help insulin resistance. What are some of the complications? Kidney disease, eye disease, nerve damage, and cardiovascular disease. These often develop earlier, requiring an increase in long-term treatment. Treatment. The first line of treatment includes lifestyle interventions, such as increase in physical activity and changes in the diet. We need to prioritize family-based lifestyle interventions, since family plays a huge role in this group. There's also the use of pharmacologic interventions such as medications like metformin and GLP-1 agonists. Combination therapy might also be the most effective depending on the severity of the disease. AI applications. Artificial intelligence is increasingly used for early detection, machine learning risk prediction, and disease management. Some examples are the use of continuous glucose monitoring with systems like Dexcom or Freestyle, personalized treatment plans, the use of mobile health apps, and AI-assisted diabetic eye exams. These tools are more personalized and a more proactive approach to treating and managing the disease. AI ethics. Algorithmic bias can be present. There's an unequal access to technology due to the socioeconomic status. There's data privacy concerns with using different databases and apps. And there's a risk of wide disparities due to these tools being more money. Public health implications and recommendations. Addressing pediatric type 2 diabetes requires the need for early screening and prevention strategies. It is necessary to implement community-based prevention programs, such as nutrition programs, and addressing the social determinants of health to improve access to care, such as food access and healthcare availability. Some of our recommendations. For health educators, it is important to implement school and family-based lifestyle interventions. For clinicians to conduct early screening, especially among the high-risk youth, and for policymakers to improve access to healthcare services and addressing health disparities. Conclusion. Type 2 diabetes in youth is a growing epidemic with significant long-term health consequences. Early intervention and multi-stage treatment strategies can help improve outcomes and support long-term management. There's an urgent action to address disparities, particularly among minority groups, who are mostly affected. Here you can see our references.